handles that and drives that for me is Fred Propol, the CEO of Beck Construction. At no time did we consider closing construction. What we actually have done, and I'll answer questions about that because we'll have an order that goes into effect at midnight on this, is we worked with the Home Builders Association, the I can't remember who else, the Mexican American contractors, the black contractors, the DFW Minority Supplier Council, as well as the Texas Organizing Project with the Workers' Defense Fund and the AFL-CIO to improve workplace safety. There's other things on retail that we'll be doing as well. I've got some not good news tonight, and then we need to have a conversation, you and I. We're going to have some tough conversations in the coming weeks, and this is one of them. So today we have seen clusters beginning in nursing homes here in Dallas County. At the Edgemere Senior Center, we have 4 confirmed positive cases in the skilled nursing facility. That facility, Edgemere, has 4 units: memory care, assisted living, independent living, and nursing, skilled nursing. The cluster is in skilled nursing. There is one resident in the independent who is ill. We believe that person has been isolated, independent. They live in apartments, okay? And and then unfortunately we have one employee who traveled quite a bit through the facilities who's one of the positives. At Skyline Nursing Home, we have 4 positives and two additional pendings. That means that their tests aren't back yet. We have a positive at the hospital, and asymptomatic. And so that's 2 clusters at 2 long-term care facilities. Additionally, just in the in transparency, we have another patient at another nursing home. That other nursing home is Monticello West. We believe very much that that is not a cluster case. That person is in the hospital. They've been in the hospital for several days. We've tested some people there, and we believe that is not a cluster case, but we want people to know that. Additionally, in the last 30 minutes, we have another nursing home. We will get you that information either by, the families have a right to know about this before the public does. And so we'll get you that information after the families have been notified. Due to this, we have spent all of this is since I woke up this morning, and we've spent a good part of the day today with our nursing homes and with our healthcare system. And so I'm announcing the following changes that will go into effect immediately. They are likely not the only changes that will be in effect by the time people wake up in the morning, but this is what we're doing effective immediately. All staff from all levels of care or any job description within a facility must be notified immediately of the COVID-19 diagnosis in residence. This notification shall be done in staff meetings by phone, text, or email. This complete notification must be done and must be reported and proven to be done within 6 waking hours, as soon as possible, but within 6 waking hours to Dallas County Health and Human Services. Same thing for all patients who are mentally competent. Same thing for all family members that they know of. Same thing for all responsible parties. Every person in a nursing home has someone on the outside, even if they have no family, called a responsible party, and they have to be notified. The facilities are all closed immediately, including the one that you'll find out about later, to new admissions, and they'll each be closed immediately to new admissions if there's a COVID positive in those homes. All patient transfers out of nursing homes with a COVID positive to another nursing home, and this includes people who are not COVID positive, is prohibited. That does not mean that you can't take your loved one home with you, and that's the conversation that we'll have. All HCP, all healthcare workers must wear masks from now on for patient care at all times in long-term care facilities or nursing homes, which in long-term care facility is a term of art for nursing home, memory care, and assisted living. All must have temperature symptom checks prior to each shift, and that must be done on site. That is not something we're going to take your word for at home. We want you to go take your temperature at home, but we're going to take your temperature when you get there, and if you have a temperature that's higher than the range for a healthy person, you got to go home. All staff will no longer be allowed to work at any other facility. These part-time shifter staffs, that ends if you've worked in one of these nursing homes. Pick your nursing home. We're not going to have a situation, unfortunately, and this is tough for your family, but we're just not going to have it, and it's tough for our staffing, but we're not going to have a situation where somebody turns up positive and they've gone to 6 homes. All right. All administrators will keep a list of all employees who've worked at other facilities, including the name and contact information for the administrator. I want to make clear to the nursing home industry that we are with you. You are healthcare heroes, but you will comply with these orders to the letter, and it's imperative that you follow these directives that the medical community is working on as we speak. Here's the tough conversation part. I went and got my mom from her independent living facility. Maybe 3 weeks ago. It's just a situation where when COVID goes through a nursing home, if you look at what's happened in Oregon, if you look at what's happened in New York, it's really hard, and it's a high morbidity rate that happens there. It's really hard to keep that from spreading there. So we didn't have nursing homes, to any appreciable degree 2 generations ago. And there are other places and other cultures where their seniors live with them, and they find a way, right? And I know you've got seniors, and you just can't take care of them because their needs are too great. But at the same time, we're home, right? Maybe you got a 2-worker family to make ends meet, but we're home now, and so I want every family to really question, could they take care of a person and maybe try to get them home. Again, it doesn't mean that you can't bring your loved one home from one of these places, but then who's not sick, that does not have COVID, but it does mean that once you bring them home, if they were in one of these nursing homes, that you're all under quarantine under our orders until Dr. Huang tells you that you're not. And with that, Phil, will you give a report on the new cases and the cases that we've had since our last briefing on Thursday, and then we'll open it up to questions. There is a lot of information tonight if you want to talk about it, about safety for construction workers, but we can also just put that up on the website. Phil.
So since the last briefing on Thursday, we had 64 cases on Friday, 72 cases Saturday, and 49 cases today. So bring 185 new, that total, and so 488 total cases now as of today. Also, last when we reported that the jail, there were 11 total cases, 10 inmates and 1 detention officer, and since that time, then we've had 3 more symptomatic that testing results are still pending. So I think that's the latest on our numbers with that. And also, I guess today we did report our 10th death, which was a woman in her 80s who'd been a resident at one of the long-term care facilities. This person had been hospitalized and had other chronic health conditions. It's about 65% of those that required hospitalization thus far are over 60 years of age or have at least one known chronic health condition, and about 36% of our hospitalized patients are requiring admission to intensive care units.
Judge, you opened up the question.
You were talking about, after looking at what happened in Washington, you're talking about clusters. I'm assuming the tone you're taking is feeling that these numbers are going to continue to rise, especially in these facilities, possibly because of people being of older age and already having possibly some other conditions.
And the way that healthcare works in the nursing industry, where workers travel, and the fact that we have 1 positive worker and other tests pending. So this is a situation. It's where this is a situation where we're going to see other nursing homes, and so you've got some decisions to make as a family, and my decision may not be your decision, and but you got some decisions to make. I will tell you that it's Phil and I talked about it. And it's our belief that, but for rare circumstances, your loved one at this time, and maybe last month they were better off in the nursing home, but if you can take care of them, they're probably better off in your home. So I guess that's the answer to that. Yes, sir.
So I think you said something about if they do decide to take their loved ones out of one of these homes, are you then, is the county somehow tracking this individual?
Yes. So
how is that working?
Yes. So if you take and the question was, how do we track it if you take a person out of a nursing home that's COVID positive? When you take the person out of the nursing home that's COVID positive, there'll be protocols for transport. They'll go to your home, and then your entire home will be under quarantine for a period of days. If they're asymptomatic, and correct me if I'm wrong, Phil, that's 2 weeks. That's 14 days, correct? So before you pick up your loved one, you'll want to stock up on groceries, because when you're under quarantine, you cannot go to the grocery store. You cannot go anywhere. You cannot go out for a walk. If you want outdoor activities, it'll be in your backyard during that time period. And then, of course, if that person or anyone in your family becomes symptomatic, then we'll work with you on that, and you'll be under a different timeline, generally 3 days after fever has ended with no fever reducers, then the person could be cleared. But for the patient that you bring home, it's 14 days. And I'll say this to our nursing homes. We're not going to have a situation where you send a bunch of patients to the hospital and then refuse to take them back. Okay, there's a law on that. It's called EMTALA, and we're not going to do that here. We're going to work with the medical community to lay out guidelines on how this is dealt with. I don't know. That probably is a private conversation. I'm sure that the audience isn't not very many nursing home owners in your audience.
Judge, when it comes to the employee, so do you all have a track of where that employee traveled? Do you believe that employee traveled between those several nursing homes that you mentioned?
We'll have more information on that, and we'll get it to you. You had a question. The question was, do we know where the employee traveled? And there's a tracing underway, and tracing means we're interviewing that person and getting that information, and then we'll be watching extra close in those places. And you're next. You had a question.
On a different topic, but are you thinking about opening new places like the convention center that was announced today?
The convention center will be opened. I had a call the question was about the Convention Center Hospital. I was on a call from about 4 to 4:25 today with the CEOs of all of our hospital systems, Dr. Huang and Peter Bonowitz, who you met earlier, who's my special assistant over the unified healthcare response, and they're discussing the best way to utilize that hospital. So will that hospital, and a lot of that depends on whether or not it comes with staffing. We've had 130 healthcare heroes that have stepped up so far to sign on to our list, thanks to the great word that you guys are getting out to them. And I'm sure we'll have more. We can use some of those. But if these hospitals come staffed, which my information is they don't, then we'll have to use it farther down the chain. But if it comes staffed, then we would probably use it as a transition hospital. We got some great we have some great ventilators at UT Southwestern, Parkland, Baylor, what have you. So we're set up. We've been working hard. We've been drilling. We're ready for this at every hospital. And so the people on the vents will be there. But then as we move you off and you don't need a vent, but you need care, that may be where that is. But I've got to get some visibility from our federal and state partners about if they've changed their mind on sending me the assets I requested in our STAR request. Because apparently while I was on a bunch of other calls, the governor said something that indicated maybe he could send some doctors here. I was told by his staff 2 days ago that wasn't a possibility. If it is, thank you, Governor. Thank you, federal partners, for sending us the hospital.
How soon, just on that point, how soon will the convention center be operational, and how needed is it right now? How close are we to capacity at North Texas Hospital?
Okay, so you're asking about the convention center, how close are we to capacity? We're at pretty good capacity now, particularly as we double up on beds in our major hospitals. It depends how fast it comes online is where the doctors come from. If the feds and the state can send us some doctors, even if they send a chief nursing officer or a chief medical officer and a few others, then it'll be online faster than if we have to do it ourselves. The CEOs make some great points on the call with me today. It makes no sense to pull people from UT Southwestern or Parkland or Baylor so that they're less effective there to go run basically an Army field hospital in a parking lot. So we need that, and it won't be in a parking lot. We'll put it inside the building. But anyway, we need the doctors. So federal and state partners, we need the doctors.
I had a question back about the nursing homes.
Yes,
You mentioned that there are clusters that you're seeing in the long-term care facilities. Does that indicate that the residents are passing it between each other, or do you have an idea of how the spread is working?
We don't know whether it's the residents or the employees. What we do know, and so much is unknown, but what we do know, we'll tell you. And the question, let me repeat the question. The question was, how is it spreading in the nursing homes? Or is it the employees, or is it the residents? And the short answer would be we don't know. What we do know from Oregon, from California, from New York, and for that matter from Italy and Great Britain and China, is that when these things get into the nursing homes, they spread, and they spread rapidly. You'll get into a situation where virtually everyone there has a very high chance of getting it. Yeah.
Who was the 10th death that was announced today? She was in a long-term care facility. Do we know which one that was?
That was in Edgemere. And the question was, the woman who died today, what long-term care facility did she live in? And the answer was Edgemere. And you had a question, yes?
Do you know of the nursing home clusters, how many are hospitalized right now of those COVID positive patients?
Bill?
Yeah.
Oh.
So I believe all four of the ones at Skyline are currently hospitalized. And one of the residents in Edgemere is hospitalized.
And with that, go ahead. Any other questions?
Judge, earlier you were talking about just the sternness of making sure that the nursing homes and the long-term care facilities respond to y'all? Were you having an issue with people giving you all numbers with possible cases?
You know, we're going to make sure that there's full compliance, and I have every expectation that every nursing home will follow these orders. And you know, I mean, we're dealing with frontline healthcare heroes who are doing their best and putting their lives on the line at this point. I'm just to be frank with you, so that they can protect your loved ones. So if anyone did anything, you're not going to hear about it from me on a news conference. Yes, sir.
Just, and this is a different topic, just in your opinion, how are North Texans doing as far as the social distancing, especially like out in public places? I think we were out at the Katy Trail earlier today. It was pretty crowded out there. Is there some type of consideration on your part to maybe try to change things up when it comes to places like that?
Yeah, the question was about the busy places like the Katy Trail. And yes, we will be making some changes. You'll see basketball goals coming down, which breaks my heart as a basketball guy. You know, it ought to be the kids could shoot some hoops if they're just stay away from each other, but that's not going to happen now because people are violating the order. You'll see us move from a posture of friendliness, and we'll always be friendly. I mean, we got great officers here, but you will see some ticketing enforcement happen in situations like that, and you'll see us just have to continue to ramp up, making it more difficult for people to do that, because what happens is if you're jogging south in a huge cluster of people, and I'm jogging north, and there's a huge cluster behind me, by the time you get through jogging, you've probably breathed the droplets of a couple thousand people. And so what you're doing there, and of course they're all breathing your droplets, and so for those, think of all the people that are sacrificing, like our seniors, who are doing everything they can so that this doesn't visit them, like the small businesses that are shut down, and their employees that are without work, who are so hopeful, as I am and as we all are, that this nightmare will end soon and that we will be able to get back to our lives and doing our jobs. And so when you're out there being irresponsible, and it's not everyone, it's a few, but and you know, it's like my mama used to say, you know, a few of you screw it up for the rest of us. So, you know, it's a few. But I'm seeing good compliance for most of our people, but not so good at these parks. And then I'm seeing people, and we're dealing with this. I had a call with the Retailers Association today, and they're working through the night and tomorrow to address some of the situation where people have cabin fever, and they're just going to hang out in the big box store rather than actually buy anything. And that's dangerous because you're just turning with these grocery stores and the Home Depots and Lowe's, they're heroes, right? Their workers are heroes. They're in there getting breathed on and being near tons of people so they can keep the supply chain open for you. And it's a slap in the face of those supply workers, those grocery store workers and those Home Depot workers for you to go hang out at the place where they have to work and be essential business. So we'll have some rules on that. In fact, if we stay here long enough, I can read some of the rules that are going into place.
I was yesterday at Bachman Lake, and I saw a lot of young people there without the 6 feet. And most of them, when I interviewed them, they even told me coronavirus doesn't exist. 3 young people told me that. But my sense is that they don't believe also that enforcement will go to them.
Well,
the order enforcement. What is your message to them regarding the order enforcement? Because they are like, they don't believe something's going to happen if they don't follow the order.
Yeah. So my message to them is the city of Dallas is looking at ways to bring them into compliance, and those ways will include, you know, a variety of enforcement for you, and it's unpleasant, you know, like getting tickets or having your park, you know, God, we don't want to shut down parks, but public health comes before amenities. And so, please help us help you by observing social distancing. And social distancing means physical distancing. It means 6 feet. Now, you'll see people, because I also was at Bachman Lake yesterday. After I did a brief interview with someone and got off a call with the city of Dallas about White Rock, I jumped on a bike, rode 20 miles, rode around Bachman, rode the length of North Haven, rode through 4 or 5 neighborhoods just to check and see how things were going. In those neighborhoods, I saw great social distancing. The only people that I saw that were within 6 feet of each other appeared to be in the same family, okay? And I assume they're probably within 6 feet of each other in their house, too. Moms with their kids and the like. I saw great social distancing on North Haven and Bachman. In fact, I took some pictures, of that. But I'm sure everywhere you go, it's not happening as well, and so that's where the officers are going to help with that.
You guys might have said it, or you might not be able to. I think you said it off the top. Do you have the exact numbers of how many cases in Skyline and Edgemere?
Yeah,
you said, is it for the hospitalized? And these are the numbers that you read, Dr. Huang?
For Skyline, 4 positive, and for Edgemere, 4 positive, including 3 residents, 1 employee, but one of the residents was one of our.
Okay.
So is that 6
So
with the deceased person, or it's 4 residents?
Oh, come over here and talk.
It's 5 total, and that includes the 10th person who died.
At Edgemere? No, it's actually 4 positive, 1 employee, 3 residents. One of the residents was the person who passed away. And I want to just say one thing. We were changing some of the nomenclature, and the judge referred to that from social distancing maybe to physical distancing, because I think the World Health sort of has made that move that we really want people to still socially interact and things, but it's the physical distances really.
Any other questions? I want to be respectful of your time and respectful of your viewers' time as well. I do have information on construction safety. It will go into effect tonight at midnight, but we can talk about that tomorrow if you like.
I just have one follow-up. I spoke with a Postal Service employee today who is an essential employee and has an autoimmune disease and has to go to work and says that he doesn't believe the Postal Service is taking enough measures to protect his safety, as they're working in close contact at the distribution center where one of the positive cases came out of, at least announced earlier this week. What is your message to that employee?
Do I need to repeat that, or you might? Okay. Just repeat it. So the question was there's a postal employee with an autoimmune disorder, and he has concerns that he's not being he's not safe at work. Let me ask Jason, sorry to put you on the spot, but are the websites up now for essential employee safety concerns? So tomorrow we'll have a website with a Google form. And what is the name of the website?
It's going to be help.dallascounty.org.
Well, I don't think so, but we'll see what that is, but maybe it is. But we'll have a web link for essential employee safety concerns. And so you'll be able to go on there, fill out a Google Doc, or fill out a little thing like you do, like a complaint about your package at Amazon, and he'll send that in. It'll go to our team of lawyers, and we'll look at that. Look, the thing that we would have talked about at some point, either today or tomorrow, is the work that we're doing on employee safety. Construction workers being the first one, and retailer and big box stores being the second one. But a lot of those things will push down to every place, like prohibition against retaliation on employees for COVID related to quarantines, certain requirements about temperature, requirements about rest breaks, requirements about hand washing, safety, distancing, having only essential people at a job site, ensuring that the shifts, to the extent they can be, and that the rules vary by industry, are small enough to where you can have a 6-foot distancing, and we'll go through all those things tomorrow. Thank you so much for for everything that you're doing, Dallas. Thank you for all the people who are taking these orders to heart and are helping us to get this ended more quickly. I love this community, and I'm so proud of y'all. Tough decisions for you to make, tough conversations for you to have, but we will get through this together. And so with that, I just want to thank you for listening, and everyone have a good night. Thank you.
Judge, just a point of clarification. Particularly, you are advising families if they have the ability to take care of their loved one, to remove them from nursing homes if they are able.
On a case-by-case basis. I don't know about you. For instance, if they're in an independent living facility like my mom is, I mean, my mom drives all over the place. Y'all know my mom, she's more active than I am. Everybody in town knows my mom, right? So the only reason she ain't living in my house is because she don't want me to go outside. But so I brought my mom home. I'd see maybe somebody else's, mama has memory loss.